This is not a drill.
A possible pandemic.
Today we are announcing the first presumptive case of coronavirus in our community.
That could cause pandemonium.
And now Las Vegas is in play.
Those that have had exposure are being asked to self-quarantine.
Fear is already spreading faster than the virus itself.
They're afraid of the virus.
As you can see that today we're like half full.
Supplies flying off the shelves, the stock market volatile, and many big local events now canceled.
Right now, we separate truth from myth and turn to the experts for facts, not fear.
The antidote to fear is knowledge and preparedness.
And now, 13 Action News brings you Facts, Not Fear, a coronavirus special. With 13 Connects, sponsored by Subaru of Las Vegas and America First Credit Union.
Good evening and thank you for joining us. I'm Trisha Keene.
And I'm Ty Quinones. This broadcast is all about separating fact from fiction.
A lot of you at home have been calling our newsroom and reaching out through email and social media with your questions and your fears.
And so now we're bringing those concerns directly to the experts. Our 13 Action News team is standing by right now waiting to answer some of your calls.
That's right. If you have a question, call the number on your screen, 702-368-2255. You can also email us at questions@ktnv.com or reach out to us on our social media pages.
All right, so let's begin. We want to introduce you right now to our expert panel. First, we have Dr. Furman Lagun with the Southern Nevada Health District.
And next, we have Dr. Jinsy Jacob, a pediatric physician and medical director of Quality Innovation and Research for Nevada Health Center.
And Dr. Amy Stone is a viral innate immunologist from Touro University.
And Dr. David Jennis, clinical director for Southern Hills Hospital.
And also we have Dr. Taylor Parker from Lone Mountain Animal Hospital here to talk to us about how the virus can affect your pets. Thank you so much for being here for this special event. We so appreciate your time.
Glad to be
All right, now right before we begin taking them questions, we do want to break down coronavirus by the numbers.
That's right. COVID-19 has infected more than 100,000 people worldwide. Here in the United States, hundreds have fallen ill, and it appears we have a growing number of cases here in Nevada. And we want to start really with the most basic question for you, Dr. Amy Stone. How do you get the coronavirus and how does it spread?
The coronavirus spreads through droplets. So that means someone who either exhales those droplets or coughs. Then another person either gets within range to breathe those in, or more likely, those droplets get on a surface that person then touches and then touches their face, particularly their eyes, their nose, or their mouth.
Hence all the hand washing. And how do you ward it off? What do you need to do?
The most important thing is good hand washing, being sure that when you wash your hands, you're doing it properly, scrubbing for 20 seconds with soap and using water, and doing that hand washing frequently.
Is there indication, does this virus travel easily or more easily than the cold virus versus influenza? Do we know that yet?
We don't know that yet. Based on other viruses that are similar to this one, like SARS from the 2002-2003 outbreak, we think it spreads similarly, so about as easy to spread as influenza and the normal cold viruses.
All right, now this next question was sent to us via email. Let's get to that one.
Right, Judy is asking, why has the health district not announced the location of the suspected illness? At least say which part of town, North Las Vegas, southeast, or west. That way people aren't freaked out who live in other areas of the valley. It seems like a disservice to not indicate where the victim is.
Yeah, and so Dr. Lagun, I guess this comes to a point of the public's right to know versus privacy. Can you explain why more details cannot be released?
Sure. It is a standard procedure in terms of disease surveillance and communication. We don't communicate the place of residence of any patient because that is violating the confidentiality, and it's also part of the surveillance protocol, HIPAA protection, and so on. We communicate the elements of the disease, what needs to be done in the community, and areas where we are interested on doing certain interventions, but we never disclose the place of residence of any patient that we.
Because you feel like it's the patient's privacy that has to be paramount here.
Yeah,
and I'm curious, Dr. Jennis, then picking up on that question, does that also help in an indirect way add to some of the fear and maybe even borderline panic because people don't have enough information and so they have that sort of paranoia?
Yeah.
Absolutely. I think the unknown
Right.
Having lack of information certainly can perpetuate these fears. And so by having this conversation this evening, hopefully we can provide a lot more education, information, and hopefully provide some calmness throughout our community.
And so what we've seen, a run on stores, a run on water, a run on medication, all these different things that people are doing, is this just, are we getting way too fearful, or is there a need to actually get extra water? I mean, explain this.
So I believe that our community members are responding in a manner in which us as human beings are programmed to a certain degree to respond. And so individuals have this primal instinct when they feel threatened or experience fear, fear of the unknown, that we respond in certain ways that may be out of character or inordinary than how we typically respond to daily life situations. And so I think it's really important for individuals to gain perspective in regards to what we're discussing this evening, and so that we can formulate rational thinking in regards to what we're talking about this evening.
Go ahead, yes, please,
and
go ahead.
I just want to add on. So there's a lot of fear about the spread and everybody just needing to be isolated.
Right.
So really what I want to say is it's not the zombie apocalypse, okay?
Right.
It's in most cases, even if you do get the coronavirus, for most healthy adults or in children, it is like a cold, okay? But there is a subset of people, say people over 60, especially with medical illnesses, who are at a higher risk. So those, you know, for people like that, it makes sense to take a few protective measures, but not to the point where you're buying, you know, toilet paper for a year.
Right.
So yeah, that is a good point to bring up, because we've heard a lot about this virus and how it does impact older people or people with previous respiratory issues. But in terms of how it's impacting younger kids, and we have kids who go to school and preschool, what should be the right amount of concern should we have for our children?
Right. So if you know someone, you know, who has the virus and you've been exposed, obviously take the appropriate measures. But apart from that, I think at this point, it is okay for our children to go to school. And once we get to a point where, you know, we need to rethink that, I think the Southern Nevada Health District and the CDC will give out more guidelines. But at this point...
And at this point, CCSD is saying we're going to stop all field trips and out of town at this point. Is that a good idea to do?
I think that's fair, just to minimize large amounts of people at the same time, just to protect the spread. And I think a lot of conferences are getting canceled.
Right.
Like I was supposed to go to HIMSS, which is the biggest health IT conference this week, but that got canceled. So I think we're doing the appropriate things, the common sense things to prevent the spread.
And of course, we want to get to as many questions as possible. So of course, people are calling in on our hotline. Let's go out to Joe Bartels right now, who's fielding some of those phone calls. Joe, what do you have so far?
Well, Todd and Tricia, we have a lot of folks calling in right now, so please do, if you can't get through, please keep calling, because we'll try and answer your questions here on the air. You can see some familiar faces here. We have Darcy Spears answering questions and taking your phone calls right now, and Danny Beckstrom. Danny, you were taking some interesting phone calls. You have some questions here.
Yes, we have Tiffany from North Las Vegas, as well as Margaret. And Tiffany's husband is, he works at a casino. He's a security officer. And Margaret's daughter is a housekeeper. And they're wondering how to keep themselves safe when they don't know the client's medical background or travel history, anything like that. And the casinos, hotels aren't providing masks. So how do they keep themselves safe?
So the question there is, folks who have direct contact with the public, how can they keep themselves safe if they can't actually wear a mask or something like that, especially if they're on the strip or if they work security?
Yeah, great question. Did you guys hear that clearly?
Okay, so the question is, people want to know how to protect themselves if they're, let's say, a cleaning lady, or they're working on the strip as a dealer, and a lot of the companies aren't allowing you to wear the gloves or a mask. In fact, I think we had one caller earlier who said they got written up today because they wanted to wear the mask at work, and gaming companies aren't allowing that. People want to know how they can protect themselves when they're working with the public.
Unfortunately, a mask doesn't actually protect you unless you're sick and you want to stop the transmission of the respiratory droplets. The mask doesn't actually protect you from getting sick.
But what about wearing latex gloves?
I'm going to defer to you.
Okay, sure. Well, the first thing is about the mask. The mask really is recommended for healthcare workers because they are a high risk of exposure because of their profession. The mask is not recommended for people who are healthy or well. Regarding wearing gloves or other items, that I would say that depends on what kind of work the person is doing and in what capacity. And I'm sure that's something that each company has their own policy, but for example, those employees who are doing the environmental cleaning or rooms or other areas, I'm sure that they are asked to wear gloves to protect themselves.
Okay. Yeah.
All right.
Good question.
So great start here. Now remember, of course, right now, if you do have a question, the number to call us is on your screen. It's 702-368-2255. You could also email us, by the way, at ktnv.com or reach out to us on any one of our social media pages. We want to hear from as many of you as possible.
That's right. We want to get to all of your questions. So we'll be right back. Stay with us and send in your questions. Don't forget. You're watching Facts, Not Fear, a coronavirus special.
Thank you, Emily. And what was that, Rudy? Okay, I don't hear anyone saying any mic checks to me. Mic check 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Mic check 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Check, 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 mic check. I'm on IFB 5X, if that matters.
And welcome back right now. You are watching Facts, Not Fear, a coronavirus special.
We have put together a panel of local experts, and they are here live to answer your questions tonight. Let's introduce them again. Dr. Furman Lagen with the Southern Nevada Health District, Dr. Jinsey Jacob, a pediatric physician, Dr. Amy Stone, who studies viruses and how they spread, and Dr. David Jennis, a clinical psychologist, and Dr. Taylor Parker, a local veterinarian.
All right, so right now, if you do have a question for our experts, call the number you see on your screen. You could also, by the way, email us questions at ktnv.com or reach out to us on our social media pages as well.
And we have been getting a lot of calls from many of you since 3 o'clock this afternoon.
All right, let's go back out right now to Joe Bartels. Joe, what do you have?
Well, Todd and Tricia, a lot of folks calling in here, so please keep the phone calls coming. And we do have Darcy Spears here. And Darcy, you just got an interesting phone call from, looks like Janet in Southern Highlands.
Yeah, Joe, Janet in Southern Highlands has a question about wiping down surfaces with bleach wipes, for example. Coronavirus has been reported to have lived on surfaces, anywhere from 2 hours up to 9 days. So Janet's question is, how long do the effects of that bleach wipe on a surface last? How long can you be confident that there's enough to kill the virus?
Dr. Amy Stone, great question, right? We see, can these sort of Clorox wipes and others, do they help against the coronavirus, and how effective are they?
Yeah, your normal household cleaning products, for the most part, that kill other viruses will be able to also kill the coronavirus. The CDC has put out a list of approved particular products if you want to be 100% sure that it's going to work on in your particular situation. Being sure that you wipe things down thoroughly and that you don't miss any spots, that spot will be clean until someone else comes along and possibly exposes it. So as long as there isn't any exposure to those droplets, that surface should remain clean.
One of the things I want to know, a lot of folks watching have pets at home, and Dr. Taylor Parker, do dogs or cats have coronavirus, and can they spread it?
So coronavirus has actually been a virus in dogs and cats forever, for a long time, just kind of like the flu. This new coronavirus we know very little about. There's been one documented dog that's been exposed to it in Hong Kong. The owner had positive testing and the dog tested weak positive. So we don't know if it's really happening where they're spreading it to our animals. The dog has 0 clinical signs at all. It's actually healthy and just being quarantined at this time. So there's actually, normal coronaviruses that we see in everyday pets versus this one. And right now we've only had one case to let us know that there is a spread from human to pet.
So what's the recommendation then for pet owners?
Right. So I know we've had a lot of phone calls about the coronavirus vaccine. The vaccine that we actually have is for a gastrointestinal coronavirus. So there's 2 types of coronaviruses mammals can get. There's respiratory and GI. The only vaccine we have is for the GI. So a lot of people are like, can we get the coronavirus? Do we need to get it for animals? It's a completely different strain. So right now, the best thing for protecting your pets is obviously if you're sick and if you're showing signs of the flu or coughing, we recommend you don't, snuggle your pet as much, don't have them lick your face, don't have them up where you're coughing on them, things like that, just like normal protection if you are sick.
Excellent points, thank you.
All right, we'll be right back.
back right now to our special on the coronavirus, facts, not fear, and we are getting another viewer question via our email.
That's right. Amelia is asking on behalf of her mother, how can I, as a teacher, explain coronavirus to students who are panicking and scared of spreading the virus? And Dr. David Jenis, this is really good for you.
Yeah, that's such a great question. So many young people are learning about the coronavirus from their peers, from social media, from the TV, and they're learning about ideas around the coronavirus, what's being perpetuated in social media. So I think it's really important for our parents as well as our teachers to explain to our children that the coronavirus is similar to the flu. And explain to our young people in an age-appropriate, developmentally appropriate way that the virus presents similarly as a common cold and how the flu presents.
And you think it's vital for those kids to hear this from their parents or teachers, someone they trust first?
Absolutely. I think it's just helpful for them to receive accurate information from those that they trust and that they feel secure and safe with, and have an open conversation with those individuals where they can have an opportunity to ask questions, become informed, and to be reassured.
Yeah, it can be scary hearing the news and just seeing clip-its if you're a child. I mean, my son had a small rash, I think I was telling you. He said, Mom, do I have the coronavirus? Because he sees the graphics on TV.
And we see plenty of adults panicking too, so that also doesn't help as well.
Right.
All right, we got a lot more questions to get to. We'll be right back, everyone.
All right, let's get to another email question.
Yeah, we've seen a lot of this about packages. Of course, people wondering about packages from China and now elsewhere. Is there a real concern, Dr. Stone?
I think it's unlikely that anyone would be getting the coronavirus on something that came from China. Given how long most goods take to cross the Pacific Ocean, the virus would most likely be dead before it got to America. Where we might have a little bit of concern is in some of those distribution areas where people who may not feel like they have sick time to take may come in when they're sick. And so the best thing that we can do is support our companies and support our workers by encouraging them to stay home if they're sick.
All right, should you wipe down packages? Would that help with the Clorox wipe? Does it help if you...
It could help if you're worried about it, but in most cases, it's probably unlikely to be super helpful. It'd be much easier to, after you get your package, be sure you wash your hands well and avoid touching your face between when you open that package and when you wash your hands.
Thank you so much.
I just want to make a comment related to that.
All right, we have to wrap. We'll do that on the other end of the break.
Okay.
So we've reached the end of our time here for
Right.
this discussion
On
the air, but we will continue on our streaming channels as well as ktnv.com on live stream too.
All right, so please keep your questions coming on for our expert panels. Our 13 Action News team is going to be here answering your calls. Use the number on your screen right now. You could also email us more questions at ktnv.com.
You've been watching 13 Action News, Facts, Not Fear, a coronavirus special. With 13 Connects, sponsored by Subaru of Las Vegas and America First Credit Union. And now, 13 Action News brings you Facts, Not Fear, a coronavirus special. with 13 Connects, sponsored by Subaru of Las Vegas and America First Credit Union.
And good evening, and thank you for joining us. I'm Trisha Keene.
And I'm Ty Quinones. We are bringing you concerns about the coronavirus straight to the experts right now. Our 13 Action News team right now standing by, waiting to answer all of your calls, to answer all of your questions.
And if you have a question, call the number on your screen, 702-368-2255. You can also email us at questions@ktnv.com or reach out to us on our social media pages.
All right, so let's once again introduce our expert panel. First, we have Dr. Furman Ligon with the Southern Nevada Health District.
And next, we have Dr. Jinsey Jacob, a pediatric physician and medical director of quality, innovation, and research for Nevada Health Center.
Also, Dr. Amy Stone is a viral innate immunologist from Touro University.
And Dr. David Jennis, clinical director for Southern Hills Hospital.
And also Dr. Taylor Parker from the Lone Mountain Animal Hospital, here to talk about how the virus can impact our pets. Thank you so much again, everyone, for being here on air and now online.
That's right. And we've been getting a lot of calls from many of you since about 3 o'clock this afternoon.
Yeah, let's check back in right now with Joe Bartels answering all those phone calls in our newsroom. Joe, what do we got now?
Yeah, we got a lot of good questions coming in, and a lot of them dealing with pets and a lot of them dealing with children. And Darcy, you were just telling me that you just got a phone call from two folks back to back here regarding construction, and what were they asking?
So Randy from Boulder Station and Lou from Aliante both called back-to-back callers that work at different construction sites in the valley, and they're talking about how they have to use porta-johns, porta-potties, to go to the bathroom when they're working during the day, and that's the only restroom they have. Sometimes there's hand sanitizer in those restrooms, but they're concerned about how they stay safe in that situation. Is that hand sanitizer enough, or is there something else they should be doing, especially when they're only cleaned out about 3 times a week?
Interesting.
Great question. Hand
Yeah.
sanitizer, is it effective? Who wants to take that one?
Okay. Well, I think in the condition that is described, they would be better off with running water.
Yeah.
Also, how often they clean that facility in order to make sure that employees are not exposed not just to coronavirus but to hepatitis or other infectious diseases. So in that particular condition, I would say that a hand sanitizer probably is not enough.
So in this particular situation, the employer may want to look at the way that they're having these employees take care of their waste and go to actual restroom that has running water so they can wash their hands.
That you find a way to facilitate access to running water to the employees. Yes.
Would wearing gloves as a temporary fix help? Before
we're talking about the bathroom.
Right.
Yeah.
So I don't think...
Feces, yeah.
As far as being able to touch the handles and things of that nature,
right.
I mean, going in and out of the porta-john.
If they're going to the bathroom, they really need to clean their hands properly so they don't transmit infectious diseases from one to other.
Right.
Yeah.
Okay. Good answer. Thank you. We have another question that came in from our email from a viewer here.
All right, so Paul says that I would like you to explain the difference between the symptoms of the coronavirus and influenza, the flu. It's a very good question because a lot of people are confused about this.
So they're pretty similar,
right?
To be honest. Coronavirus tends to have fever, cough, runny nose, which also tends to be the case in influenza. Now, like I said, most cases of coronavirus in healthy individuals tend to be just a cold. However, if you start having breathing difficulties, so that includes shortness of breath, chest tightness, chest pain, or if you are a child breathing really fast, that's a sign that something else may be going on. Your lungs may be infected. So you want to get help.
Is there any products that you can use, let's say a Flunase or anything like that, that would prevent you getting the coronavirus, or no?
Unfortunately, no. This is not related to allergies at all, so there's nothing that you can actually take.
Nothing to prevent it.
And Dr. Stone, I'm curious about the mortality rate here of this because it sort of has fluctuated. We've heard maybe 1%, less than 1%, maybe as high as 3%, closer to 4%. Where do things stand? What do we know so far?
Based on the numbers coming out of China, we're looking at a mortality rate of about 3%. We suspect that that's actually much higher than what is really going on. And part of that is due to, just like Dr. Jacobs said, that many cases are very mild and some cases may even be asymptomatic. And so we don't really know how many people have actually contracted the virus that did not require hospitalization. So while that number seems very high, it's probably an overestimate.
And with all these conventions being canceled, you know, people being concerned about going on airplanes. I know we had the Korean Air flight that landed in Los Angeles. Should we be concerned when we are traveling? Let's say a lot of people, should we stop our lives? I mean, I travel for baseball for my son. I mean, you travel as well. I mean, should we stop getting on flights? Do we need to wear masks? Do we need to wear hand gloves, or is that overreacting?
I don't think we need to stop our travel at this time unless you're traveling to one of the places that the CDC groups into a risk group 3. So essentially those are the places, particularly countries, where the virus is in an outbreak state and at a higher rate than in other places. So at this point, domestic travel within the continental United States, you can travel and it should be fine. That's what the CDC is currently recommending.
Do you expect that possibly to change as we see like cities today like Austin canceling South by Southwest, declaring an emergency? We've seen issues now in Seattle. Is that subject to change?
Absolutely.
Yeah.
The CDC, as well as our local public health individuals, will be monitoring the situation and helping advise those companies, particularly airlines and other places where a lot of people gather, such as large venues, and advising them on taking policies that are going to both protect their employees and protect the individuals who come and patronize those, whether they're traveling on the airline or going to a concert.
And so do you suggest that you do wipe down your seat area or the window if you're sitting there? I mean, do you suggest that?
I usually do anyways,
Right.
even before this. So wiping down your tray table and wiping down the back of the seat in front of you when you first get on the plane has been good practice for quite a while now. Thinking about and being thoughtful about when you touch your face and how you touch your face is going to help a lot more. And being conscious of that while you're on the plane until you get off and can get back to that running water and then wash your hands.
Can it spread through the recycled air? I mean, lots of people get sick on planes anyway, just because they're sitting so close to other people. But is that a concern for people who are traveling?
We don't think so. Given how this
Well,
spreads...
that's concerning that you said we don't think so, right?
So here's what we know. We know it's spread through droplets, and we also know that most droplets are not going to become airborne, they're going to fall to the surface. Now, that isn't true for every single droplet that anyone could possibly encounter. And so we haven't seen that be a common method of transmission.
Okay.
It's more likely that someone within about 3 feet of you is going to transmit the virus to you. So if the people in the seats next to you are coughing and sneezing,
Right.
that's a bigger risk than someone a few rows away.
And so, Doctor, again, on that point, what are some of the danger zones, if there are any, that would make people more susceptible to getting this virus?
No, well, I wanted to go back to the plane. Actually, the CDC has a protocol for that. Basically, is looking at the distance from your seat. So they look at the people who are 2 seats around the case. So, and we're talking about symptomatic individuals. So somebody who has no sign, no symptoms is not considered a risk for a plane.
Okay. And so at this point, so if someone's not showing symptoms, but they do carry the virus, is it transmissible still at that point, in that stage? Do we know that yet?
You're saying
Could
yes.
be.
Yeah.
Could be. Again, this is a condition that is practically unknown. If you look, for example, to influenza, where a person could be able to transmit the virus within 24 hours before showing signs or symptoms, that's possible. Right. But the general approach for surveillance investigation in terms of risk for airplanes is based on how close the person is to somebody who is symptomatic, because that's what has been seen through many studies, that transmission is basically related to how symptomatic is the person and how close those individuals are, and the risk is considered for those who are within 2 seats, because it's basically 6 feet away from the person.
Do you think that airlines and the airline industry now should be increasing the amount of screening they do before people get on planes? Is that something that's being talked about?
Well, I know that the airports, they are doing a lot of work in terms of educating the airlines and also the passengers, of course. And like right now here in McCarran Airport, they are doing many things in terms of working with the airlines and educating the travelers, sharing information with them about risk, specifically for coronavirus. They also are doing a lot of cleaning at the airport with more frequency than before, just to avoid transmission of coronavirus at the airport.
One of the things I do want to talk about is the origin of this coronavirus. I've read that it started through a bat in China, or you've heard, oh, this is a man-made virus. You hear a lot of these different myths. We want to hear from the experts. What's the real deal?
So we know that it originated from Wuhan, but we don't exactly, and we think it's the animal market, but we're not exactly sure. It is definitely not a man-made thing.
Right.
My goodness.
You've heard that too, right?
Yes.
Yes, I've heard everything.
Yes, the book,
Right.
I think it was Dean Koontz. Yeah.
Right, Dean Koontz,
yeah. So that would be a very diabolical plan if we were to
That's
go
on
through.
Facebook. I mean, you see everything.
Dr. Margaret, you were saying that coronavirus is something in your field has been known about for a long time. So this, while maybe to the general public this is new information to us, certainly this is a virus, as you said, that's been around.
Right, and like for the veterinary field, we have ways to prevent it with a vaccine. But again, just like with humans, when dogs get the coronavirus, it's a multi-simplex problem. They usually have other bacterial infections at the same time, and it's called kennel cough. I don't know if you guys have heard kennel cough, but
yeah, I've heard that.
So that's, coronavirus is one of the strands that can cause that, and then also with the GI signs, dogs that have parvovirus or other, GI issues going on at the same time, they can have the GI coronavirus. So again, these are things that we know, there's no necessarily treatment for it, it's just kind of the same thing with humans.
And it's actually very prevalent in humans too. It's the most common cold virus.
Right.
So it's been around, but coronavirus is like a clan,
right.
And this is sort of a cousin.
Right.
And the cousins decided it's going to
and
have its
this
day.
is the nasty cousin.
Yeah.
Right, yes. And I'm sure, before we move on, real quick, I have a 4-year-old, and it's hard to sort of, keep their focus, and they're always sniffing, touching, and they're just, things. So what's the best advice for parents, especially parents of younger children, to pass along to the children? Again, we don't want to scare them, but we want to make sure they're listening and change maybe some habits.
Yeah, so kids are actually smarter than you give them credit for, just having experienced them for a while. So it's not going to be perfect, but going and sort of saying, these are the things you need to do, and eventually they do pick it up. It's not going to be perfect. You're not going to get a 2-year-old to blow his nose each time.
Right.
But if you persevere, they get there.
It'll get the message.
Yeah.
They'll get the message.
Does it surprise you being in this field, in the medical field, with all the cancellations? It doesn't, because you think that in the stock market and everything that's happening, is it too much? Do you think this will get this under control? And do you think that a vaccine will come sooner than we know? I mean, the president's pushing for that.
Yeah, so there are a lot of people studying vaccines, but the thing with vaccines is that they have to be extremely well studied before a vaccine is released. Vaccines are tested way more than any other drugs in the market. So for this season, it is unlikely that we will have a vaccine based on that.
Is it going to be like a year out? What are you thinking?
Hopefully, we don't know enough. I know that there's a few biotech companies working on it. There's some of the pharmaceutical companies looking at it, but we don't have any solid information yet.
I mean, typically the process of putting a vaccine in the market takes between 12 and 18 months. So you could figure out from there.
All right, again, we'll get back to our viewer questions right now. Joe Bartel is standing by live in our newsroom. Joe, what do you got for us now?
Yeah, the phone calls are still coming in, and we've got folks answering them right now. And Kalina Estrinos from Good Morning Las Vegas, she just got some new information here into the newsroom. Kalina, let's come to you right now. What do you got for us?
Yeah, so we've been tracking breaking news right now. We just got an alert about Nevada cruise ship, and apparently there were 40 Nevadans right now that were on the Grand Princess cruise ship, and they are now currently being contacted to see if they have any health symptoms that have to do with the coronavirus. So this really kind of brings up the question, what and should people actually go on cruises right now? Is this something that we should be doing? Is this something that we should kind of stay away from? They disembarked from the ship on February 21st, so this is new into our newsroom right now. Again, 40 Nevadans being looked at right now that were on the Grand Princess cruise ship to see if they have symptoms from the coronavirus. So this is something that we're going to continue to track, but that would be a great question just to ask to see if people who are planning vacations, especially with spring break coming up, if that's something that they should still be doing, going on those cruises.
Right, and so I'm curious to piggyback off that, Doctor, again, is that would you guys be made aware of that kind of information necessarily so that you guys would have to do what you would have to do to figure it out?
Well, actually, the question about whether, you know, a person should go in a cruise ship or not, at this point, I don't think anybody has enough information to say, no, don't go into a cruise ship, because there are hundreds of cruise ships going on around the world today. We do know about those events in Japan now, the latest news from San Francisco, what's going on. But that's not enough to actually to make the claim that just don't go into a cruise ship. What I would say that it is more related to how the specific companies who manage the cruise ship, what they are doing in terms of protecting the customers from acquiring an infectious disease. Not just coronavirus, but norovirus, which is also very common occurrence in cruise ships, so there are other conditions as well to take at.
And Dr. Stone, what do you think in terms of that? I mean, my sister had an Asian cruise planned, and they canceled because she didn't want to be in quarantine after. She knew what would possibly happen. But if you have something planned, you're talking again kind of like with the airplanes, if it's going to a specific country or a specific region maybe?
Yeah, I think that we need to take each situation individually and look at where that cruise ship is going and what that company is doing. Being on a cruise ship, you are exposed to infectious diseases, just like Dr. Le Guin said, that you have that kind of higher risk because you're contacting those same people over and over and over. And so it's a question of what is the cruise ship company doing and where is that cruise ship headed? And so it's a matter of what do you think your level of risk tolerance is.
And Dr. Jenna, I'm just curious, as we sort of go through, there's a lot of information to sort of sift through. At what point is enough enough? And at what point do you say, okay, I'm going to take a break from all of this?
So I believe I heard the question asked, should we stop living
Right.
and doing our daily activities?
Right, because I feel like that's sort of where we kind of go, and we won't leave our homes when we get to that point.
And that's the worst thing, I think, for us to do. I think it's really important to make an investment in our social, emotional, mental well-being, and that we need to follow our schedules. If we go to the gym multiple times per week, we need to continue going to the gym. We need to continue doing our daily living to promote less paranoia, I believe, in regards to this discussion, and promote more informed thinking around how do we just be proactive and maintaining good positive health.
I'm curious because we've been around for a while, covered H1N1, and SARS, and MERS, you know, all of these different viruses that we've sort of been through. But it seems, it's just anecdotal, that this coronavirus and this time around seems to have taken a greater hold of sort of our psyche. Is it because social media now, and is that, how do you see that?
Absolutely. So this is not too different, I think, from the millennium. 2000, where there was all these beliefs that this was going to be the end of the world, and you saw people preparing for that, like what we see our community members doing today, racing to the store, buying basic goods, canned goods, water, toilet paper. You know, they're having stores get out of stock of these basic items that we use every day. And so I think it's so important just to hold a healthy perspective in regards to what we are really discussing, what are we looking at, and that there's a lot of irrational behaviors that we're seeing right now because of maybe misinformed or inaccurate information that we may be receiving from social media. Obviously, if we see something online, we know it must be true.
Right. Yeah, definitely.
So
people. So the bottom line, what I'm getting from this: wash your hands a lot. Use the wipes if you're going to the gym. You could wipe down the equipment. They have them at the gym. That's the one good thing, and they have that at the gym. when we don't have the coronavirus.
Right.
So, yeah. Point
Right.
well taken.
So right now, again, we want to encourage everyone right now who's watching online to go ahead and call us. Our number right now is still open. It is 702-368-2255. And right now we want to check back in with Joe Bartels, who's fielding some of those questions out there. Joe.
Yeah, guys, we're getting a lot of still really great questions coming in, and one of the things that was out there right now is a question about who may be more susceptible or who may be even more immune to a situation here. Let's bring in Jeremy Chen, reporter here with KTNV. Jeremy, what was the question you got?
Yeah, so we had Hillary from Henderson ask this specific question: are African Americans really immune to the virus?
Dr.
Okay. Again, I would assume one of the many myths that are out there.
Right.
Well, okay. This question really, I really want to go back to the stigma, discrimination associated with infectious diseases. Coronavirus is not the only case. We also have seen that with HIV, AIDS, syphilis, and so many other diseases. It's important to know that this disease doesn't recognize race or ethnicity, gender. So any person from any race, any ethnicity from any country can actually acquire this disease. Right.
Yeah.
So it is regardless of what is your origin. So black, white, Asian, it doesn't matter who you are. If you are exposed to the virus and you are susceptible, you might develop the disease.
An example of, I think, again, and we're talking about these myths and that are sort of being perpetuated out there, and people, that they see it enough, they start to believe it, even though when it sounds crazy in a lot of ways.
All right, we have another question that came in from our email from a viewer.
All right, so Jane says, please have experts address ways to boost the immune system. We keep hearing this over and over. So is there a way
probiotic
that's going to help? We're saying no, right?
No, unfortunately. Even vitamin C, I'm sorry to bust the myth.
Really?
It doesn't really help. There are no studies that show that
Omega-3? Nothing?
Nothing that we
Even
know
the really
of.
expensive kind you buy?
The wild?
When you
fish oil?
when you have a clear answer with a scientific study, you let me know.
Yeah. Wow. Dr. Stone, you wanted to chime in.
Yeah, what we can say is some things that we know that depress the immune system are times of high stress, times when you're not getting enough sleep.
That's great.
And so keeping
well, that's
You've been working in the newsroom?
No wonder I've been sick.
making sure that you are getting enough rest, that you are eating healthy meals, and that you are managing your stress are going to be the best things that you can do to keep your immune system up and healthy.
So that's a great way to think about that, because I think people are looking for the over-the-counter solutions. Let me buy this and I'll drink that, and powders and shakes. But really what we should be focusing in on is how not to depress our immune system. And so I think that's really key. Can you say that again? What's the best way to look out for to avoid ways to depress your immune system?
Right, so to avoid depressing your immune system, you want to be sure that you get enough sleep, that you're eating regular healthy meals, and that you're managing your stress.
And that maybe we need an appointment with you, Dr.
Yeah.
You may want to get some help. No, it's true though, because when you talk about your feelings, you tend to release and you don't have as much stress.
Absolutely, and I think as part of our culture in America that we really don't focus on promoting or making huge investments in our social, emotional, mental well-being.
Right.
And we have to, and it's really important that we have to take a moment and stop and smell the roses. Because we're constantly running and going and working all day long. We're trying to accomplish goal after goal after goal, and that as Dr. Amy acknowledged, that if we don't manage our stress level, that's going to impact our immune system, and it's going to make us potentially fatigued, less patient, and we're at risk of other things.
Can I just,
go ahead, please.
So as a primary care physician, I'd like to say, those of you guys who have medical conditions, please go see your physician or your medical provider and get that under control, because we know that one of the biggest risks is really having a coexisting medical condition or a weakened immune system. That really is one of the biggest risks associated for a more severe version of the disease.
That's concerning to somebody, let's say, who doesn't maybe produce antibodies for strep or upper respiratory. Would they be at risk then for the coronavirus?
So if you're a for example, somebody who's on cancer treatments, things like that, with a depressed immune system,
right.
yes, you're at a higher risk. So do be careful.
All right, thank you for that.
All
Let's
right.
check back in right now with Joe Bartels. Joe.
Yeah, guys, phones are still ringing here, and we're still getting a lot of great questions. And one of the things that came in is we know about the human factors and what we should be doing, but will we get any help from maybe the weather, for example? And Astrid Mendez, reporter here, you just got a question. What was the question that you have here?
Yes, definitely. Deanna for Summerlin wants to know, will heat kill the virus once that it starts getting hot here in Las Vegas?
That's a good question.
Dr. Stone?
So at this point, we don't know. In the past, we have seen seasonality associated with coronaviruses. So for example, going back to SARS, we did see the cases drop off as we got more towards summer. And so it is possible that we may see less or fewer cases when we get towards those warmer summer months. But until we get there, we won't know.
Typically, this time of year, like I talked about today, it felt great to wake up this morning, open up some of the windows and doors and get sort of fresh air. I mean, is there any science to the idea of getting fresh air in your home or in your office space? Is that helpful at all? I'm curious.
It doesn't sound like it. Nobody jumped on that question.
It might help you de-stress,
Yeah,
right,
right.
Doctor? But other than that, there's no clinical benefit to opening
No,
up
I
fresh
mean,
air.
I mean, if you have fresh air, open spaces, actually it helps the environment. So certainly it's better than being enclosed in a small area.
And overcrowding.
Right.
Right.
Yeah.
Right. And just to breathe. You know, that's one of the that song, Faith Hill, Just Breathe. It helps you psychologically.
Absolutely, it does. And I'm glad that you're highlighting that because it's something that we all do every day as human beings, is that we breathe. But how often do we actually focus on our breath and take a moment to deep breathe? And really, it's a holistic, physiological, emotional, mental experience when we take deep breathing. And so I encourage individuals every day, do at least 4 or 5 deep breaths when we're really inhaling through our nose and we're exhaling through our mouth. And we do it multiple times because you will experience complete physiological, emotional, mental change.
That helps with your anxiety and panic, because I get panicked when I take off in a plane and I do that. I just do the deep breaths. It helps.
Yeah, absolutely.
Yeah, I should start doing that with the newscast. Hold on for the news. I have to take some deep breaths.
All right, we're going to check back in now. Joe, you have another question, Joe.
Yeah, we just got a phone call from Darcy. It was from Carlos in Centennial Hills. He was asking about at what point, if I have symptoms, where should I be going to get tested, or when should I get tested? And Danny Beckstrom, you also had a similar question about the symptoms.
Yeah, Elmore from Henderson said, okay, a lot of people have colds. At what point do I take this more seriously and actually go and get tested? Another question from Edna said, how long do the symptoms last? So at what point should she then go and get tested?
Great questions.
Yeah.
Great questions. I mean, right now, so you have the sniffles, maybe allergies you don't know, or is it coronavirus?
Yeah. How do you differentiate?
And then how do you know when to go see a doctor?
So this is a great use case for telemedicine. So telemedicine is something that most people have access to now. So use that, give your doctors a call and see where, what kind of advice you get, because a lot of times we'll be able to triage a lot of those symptoms based on that. And then we'll give you recommendations on whether to get tested or not.
And right now, as far as whether or not someone should or is eligible, I guess, to be tested for coronavirus, is it the fact that they have not traveled to China or one of these regions, is that still such an important aspect, or is that now being diminished as we see the spread of the virus?
That's changing.
Yeah.
So now the CDC just came out with guidelines that's saying it's up to the physician discretion to test. Before it was more, if you have respiratory illnesses, you need to be in the ER, or you've had those travel history. Now it's changing, and that's because we're starting to see a little more of that community spread and not just travel-related spread.
And before we end this, anybody have any last-minute thoughts that you want to share before we wrap up?
We have one more minute here.
We have one more minute.
Some thoughts that you want to leave us with.
I really just want to encourage community members to practice self-care, continue to do their everyday activities, promote positive social, emotional, mental health, and just manage their stress on a day-to-day basis by implementing their self-care strategies.
Okay,
right.
and also the fist bump, right? Was that right? I mean, the fist bump, right? We're talking
Air 5.
about Air 5. You guys
Even
recommend
better.
that's
Air
something
5.
to
Air
take?
5 is
Absolutely.
better. No contact.
Yeah.
No.
I got you.
Yeah.
Right.
Yeah.
There you go. Air 5 to all of you. All right.
Well, thank you so much for your time. This has been wonderful. We so appreciate you guys on a busy Friday. I know taking time out of your personal lives to be a part of all of us.
All right. Thanks for joining us. We're always on at ktmv.com.